Well, good morning, everyone. Happy Friday. Happy Valentine's weekend. We're gonna go ahead and get started. This, as we know, is our Durham Recovery and Renewal Task Force. And it's been, now that we're monthly meetings, it feels like it's been a while. So it's really, really good to see everyone. We've got a full agenda, so we'll jump right in, and I will turn it over to either Mayor Schewel or Chair Howerton to start with some remarks. Or Vice Chair.
Started with some very brief remarks. It's so good to see everybody. I'm sorry I was so somber, Maticia, when I first got on. I'm glad to be smiling. Excuse me. I'll just say that on a personal note, I got my first vaccine. My second one is next week. My wife got her second one yesterday, feeling okay. And I'm sorry the rest of you all are not in the age cohort. But know that more vaccines are coming soon, are coming now. There are a couple things that are on my mind. I'll say one other thing personally. I thought the chamber event was great yesterday, Geoff and Katie. I wish I had smiled more during my presentation. But I realized that, it has been a somber time. And I do feel like now there's so much hope that we're coming out of it, and we just got to get through it. But it was, I thought there was a lot of that spirit in the chamber presentation yesterday, that we are getting through it. So I wanted to appreciate that. I really have one thing that I wanted to talk about because it involves you all in your work. Yesterday, we received the results of our resident satisfaction survey. The city and the county do a joint resident satisfaction survey. And we had 637 respondents. And we do this every year, and it's extremely valuable to us. We learn about how people respond to the quality of city services and county services. We learn what's important to people. The survey was almost an exact replication of our racial demographics and gender demographics. And it was very interesting. It's always very interesting. But this year they added questions about COVID response and how people thought in the city, how they felt about our COVID response. And I just want to tell you that this survey company surveys, I think in the last year they've worked with, I think in the last couple of years, they worked with 900 localities, and they have been doing this survey of response to COVID. The average response of cities that residents feel that their city has done well in response to COVID is 37% of residents feel that their cities have done well in response to COVID, are satisfied with that. In Durham, the satisfaction with our city's response to COVID, there are 5 different categories, 5 different rankings that you can give. And Durham, in the top 2 rankings indicating very satisfied or satisfied with the COVID response, 69% of our residents were satisfied, and it was nearly as high with the county's response as well. So I'm really proud of this. There was another 19% who was neutral, and 12% were dissatisfied. But 69% satisfaction, that really speaks a lot to your work. I think that I'm really proud of how we have responded. And a lot of the way we've responded has been through what this group has done. And so I think that when I read those, I thought that you all had a real vote of confidence and appreciation from our community for the leadership that you've given. So that's what I want to say. I think that there's so much else that we know is still to come. We know that our economy is still really hurting, especially in certain sectors, hospitality, our restaurants and our festivals really continue to suffer. We still have unemployment, and we have very, we still have budget implications for the city and county. I mean, all those things are real. But I do feel like there's so much light at the end of the tunnel now, and not only with the vaccine, but I will also say that the federal legislation, if it passes, will be a significant financial boost to our city and county governments, way more than we've had. We've had so little direct help. And if the new federal legislation passes, that will change. So those are all things that give me a lot of hope. Got a long way to go, but so grateful to you all. So thank you. Let me just say, finally, I should say, I've got to preside at the city's budget retreat today at 10 o'clock. So I'm going to be leaving about 10 minutes early to get ready for that. But really appreciate you.
Thank you. I don't know if Chair Howerton is here yet. I don't think I see her on the line. Vice Chair Jacobs, would you like to share a few remarks?
Sure. Thank you, Katie. And I also want to commend the Chamber for the event yesterday and for everybody's messages who participated. Steve and Geoff, Katie, Rod, all of your messages to the community yesterday were wonderful. And yeah, just to echo what the mayor said, in the survey, there was also an indicator about mask compliance. And we were also incredibly high. I don't remember, maybe Jody or Drew can remember exactly, but it was like, I think 87% or something of residents who say that, they wear a mask all the time or something. But anyway, so that was another point for us all to be really proud of. I think just wanted to share that we do have additional rental assistance between the city and the county. I think it's about over $7 million that our city and county staff are working on the process for how that will be distributed. They're actually taking time to rethink how that's going to be deployed and in a more user-friendly manner. And probably that will start rolling out next month. And then we also, in the governor has now in his budget the budget that he signed yesterday, there is another, I don't remember the exact number, but it's close to $9 million worth of additional rental assistance that will come into Durham between the city and the county. I think that we do need to get a handle on what the need really is, because it sounds like a lot, but I think unfortunately the need is still very, very great. So what comes out of federal government is still really important. The other thing coming out of the governor's, the budget signed by the governor is again additional $335 checks to families. But again, our challenge, and I think this is important for everyone on the task force, is making sure that it gets to our most vulnerable residents, because those checks go automatically to people who have filed taxes. But if you haven't paid taxes because you are so low income, you actually have to go through a lot more effort to get that money. So just, I think we should all think about how we may be able to play a role with how we interact with people in the community to help get the word out about this, this additional funding. And I think, of course, we're going to talk more about it, but, the biggest challenge, again, for all of us is the vaccines. We'll hear more, I'm sure, about the plan for schools, and now that teachers and all Durham public, school staff are now going to be pushed up in the vaccination groups and able to start being vaccinated as of February 24th. So a lot of conversation happening right now about how do we safely reopen our schools. So maybe, Chair Howerton may have some more updates when she joins us but look forward to our conversation today. Thank you.
Great, thank you. All right, we're going to turn to a couple of brief updates that Maticia and I have. Maticia, do you want to start with the update on the proposals?
Yes. And Mayor Schul, it's very encouraging to hear our COVID response rate. Usually when I hear a high D, low C, I don't get too excited, but this 69% makes me feel really, really good, especially when you look at how we compare to others that are about at 37%. So I feel really good about that metric, and hope everybody on the task force recognizes the impact that they've had to get us to the 69%. So I'll give an update on budget proposals that have been submitted. So our budget review subcommittee met a little while ago, and we reviewed and evaluated 4 budget proposals. Those proposals included funding to continue our Back on the Bull public health campaign with a focus on encouraging vaccination and public health practices necessary to mitigate wider community spread of COVID-19. We also had a proposal that requested funding to stand up a vaccine navigator program that was coupled with ongoing town hall series to address vaccine hesitancy and increase vaccination rates, especially among Black and Latinx residents. We also had a request to fund a rental assistance program. And the 4th proposal that we had was to establish a new commission to support the safe return of festivals in 2021. All were great proposals that aligned with our work, but at this point, we've moved ahead with 1 proposal, and that proposal is continuing the Back on the Bull public health campaign. That proposal went before City Council last week in a work session, requesting half of the funding, and that was $75,000. And it's been placed on the consent agenda for this Monday's City Council meeting. We will bring forth a request for the other half to the Board of County Commissioners on March 1st. We're not recommending moving forward with the other 3 proposals yet. For the vaccine navigator program, more work is needed, and it's already started to fully explore the feasibility of standing up such a program. For the rental assistance program, Co-Chair Jacob spoke a little bit about the additional funding that's now available or that will soon be available to Durham residents. And so we're holding off on advancing that proposal. And then finally, for the festivals proposal, after further conversation with city staff and Discover Durham, instead of funding the requested proposal, Discover Durham will lead a new working group with support from Mayor Schul and city staff that can begin to move forward some of the key aspects called for in the proposal without the funding that was requested. So that's where we are from a budget proposal perspective. I'll also give a quick update on our education roundtable. So that roundtable, we met last week. Whenever the group comes together, it's a lot of great information that's shared. It's very encouraging being on that roundtable and hearing the different institutions of education speak about just things that they've done to really mitigate the spread of COVID-19, things that they're doing just to support their students. One of the things that we've heard on the past 2 calls is the people that are included in this roundtable are really appreciative of the sharing that happens during the roundtable. So they're getting a lot of value out of hearing what other schools are doing. So certainly glad that we've created that forum for that sharing of information. And there's also been some conversations about extended an invitation to maybe some private school or charter school. So that's another item that we're exploring as it relates to our education roundtable. But the group continues to meet and lots of great progress being made. And I'll turn it back to you, Katie.
All right, thank you. Yeah, that education roundtable, I am inspired every time we meet with those students because it is a combination of students and administrators, but just the commitment that all of them have had and the way they have approached this with a resilience and and really commitment to doing the right things has been really impressive. And their numbers have borne that out. Their numbers overall have been relatively low. So really impressive. We do have our upcoming Immigrant and Refugee Town Hall on February 23rd. That is from 7 to 9 p.m. And then Cece, we would love to hear from you about the upcoming Workers Town Hall.
Good morning. Thank you for letting me and bumping me up in the agenda. I apologize. I have to leave a little early for a work commitment, but I'm glad to be talking about the progress of the project that we are developing around Durham workers and the impacts of COVID-19 on their workplace conditions, as well as the status of their employment. And what we've been developing out is a project to survey workers on how the pandemic has really impacted them, their financial well-being, how their workplaces have responded to it, and then also to start to engage workers around coming to a culminating town hall where they'll be able to share stories, talk about proposals for how resources can be appropriated for specific supports for workers in this time. And I think it's really timely with the prospect of federal funding coming down. So we're really excited to be matching up with that. And what has happened thus far is we've been able to engage workers through the Durham Workers' Rights Commission, which is a standing body of the city of rank and file members of Durham unions and organizations and community groups that have really, I was able to go to their monthly meeting, and they were really excited to be able to take this on, and they want to focus this project as their first quarter project for the commission, and work together to develop the survey, to develop a proposal on how the survey can be rolled out, and then work to plan this culminating town hall, and to be able to engage other labor groups and unions in the town hall that we'll have hopefully in April. And so we talked about a timeline, the ways that we can really get this in the hands of as many workers as possible, thinking about the various industries and who's connected in terms of what unions work with these types of workers, and what community groups we can really tap to spread this out. And so we will be developing a proposal to give to the subcommittee to review, and hopefully we'll be able to get that approved in order for us to roll out the survey. We're planning for a month-long surveying process, and then to have the town hall on the heels of that in the month after. So hopefully looking at a timeline of a March rollout of the survey and then an April town hall. And so that all will be coming to the committee to figure out the appropriations needed for that surveying project, and then the culminating town hall.
Excellent. That's exciting. Great work on that.
I think so.
Excellent. All
So,
right.
I have one more update before we move to the next section. So I don't know if everyone knows, but Ryan's gonna be going on paternity leave from February the 23rd through May 17th, which means this will be Ryan's last meeting with us, which makes me happy, but it also makes me so sad. So I just wanted to thank Ryan for the great support that he's provided to myself and Katie, as well as all of the support that he's provided to the task force. Ryan, you've definitely been the glue that's been holding us together, and we're very appreciative of it, because if things go as planned, this is likely to be your last task force meeting. So I just wanted to publicly say thank you, Ryan, for all your great support.
I will echo that. Absolutely. Ryan has been phenomenal. And so thank you, Ryan, so much for everything you have done for us and for Durham.
Well, thank you both. I really appreciate that. And as I said, I will share pictures with you all. And if our little one comes early, which we're expecting, maybe I'll be back in time for that May meeting. But thank you. Thank you for that. It's been a pleasure to support you all. Thank you.
All right. Were there any questions on any of our updates so far before we move into metrics?
Good morning. Not a question, but just a comment. Thank you, Cece, for this great work and everyone else. In our surveying folks, I'm just curious to know where people are getting their information these days, regardless of income. Because, you know, I'm just old enough where, you know, there were traditional ways people got information. So, and that tied to Wendy's, Chair Jacobs, Vice Chair Jacobs' comment about the resources, new resources from the state and other places that's being made available. And just thinking about what can we do as a task force to ensure that we are helping cascade information. But frankly, I'm just not quite certain where now folks get what the best sources of information to point people to for services and things that are coming available.
Great question. Ilyasar?
Yeah, so at least for us and the way that we communicate with our community members, those brokers of trust continue to be the very key to get to marginalized communities, you know, and also when we're talking about how we communicate and how people get information from what we've been able to see is through community health workers, who, you know, that one-to-one, they have their number, so they call them up. Through social media, right, so Facebook, for the most part, and we continue to get a lot of questions, right? So if people have questions about anything, they'll put it in our Facebook. And then through radio is how a lot of folks in our community receive information, and through like the different radio station programs that we have, people call in and ask questions as well. At least that's from our experience.
Thank you. That's really helpful. Cece, your thoughts on that? Anything you're seeing or hearing?
So I think for us, the ways that we get information out is a combination of, kind of conversational one-to-one, as well as, somewhat of the digital outreach. The digital outreach is really important in terms of, being able to put ads on Facebook that folks can respond to. And then also working through, these networks that have direct communication with, various populations. So I think, in our own surveying process, what we want to see is, closely working with groups that have, density in particular populations, working with community groups like the Fayetteville Corridor, that are able to reach folks that, are not getting the information through, some of the ways that we blast it out, over technology, but we really have to, go in person or find ways that we're able to get in front of folks where they live in their neighborhoods and their communities. So we're thinking about like those places.
Great, thank you. Susan, what about your thoughts on that? You are our marketing person.
Yeah, well, certainly there are a lot of different channels that we use as an organization, and the groups and organizations that are represented as part of the communications team are all using their channels as appropriate to push information out. I do think, to get to Lois's point about, I think the general public, I still think that television is very important, and especially with younger generations, different social media sites. So to the degree that we're able, we're pushing out through those channels too.
Great. Thank you, Lois. Great question. Thank you so much for that. I think that's important as we're continuing all of this work, that we understand where people are getting their information from so that we're directing it in the right way. Great. All right. Do we want to turn to metrics now? And I'm happy to start with the hospital metrics. So in terms of our cases, last month we had 200 across the system, and we were actually in January, we were over 200 cases. That included active and resolved cases across all three hospitals. Last month, we were 136 of those 200 were what are called active cases. So an active case, again, is someone who has COVID and still requires isolation. A recovered case is someone who has had COVID, no longer requires isolation, but still requires hospitalization. So still very sick patients. Today, we are at 166 total cases across the system. 140 of those between Duke University Hospital and Duke Regional Hospital, so in Durham. 76 of those are active between Duke Hospital and Duke Regional. And yeah, 50 active at Duke Hospital, 26 at Duke Regional, but still seeing a lot of patients requiring ICU level care. So we have 33 requiring critical care at Duke Hospital, 9 at Duke Regional. So still a significant portion who are in our ICUs. Part of that is because, and we go back to what I've shared before, we are a referral center. So we're getting transfers in from smaller hospitals throughout the state and throughout the region. And so some of that is because as a major referral center, particularly Duke University Hospital, but also even Duke Regional Hospital, we do get those transfers in of very sick patients. And so that is some of why our ICU numbers continue to be high, but we do continue to see, even though the numbers are coming down, and that's good news, it's a much better, we're in a much better place than we were a month ago, immediately post holidays. They're not where we need them to be. So still need to stay vigilant with all of our precautions that we're taking. In terms of the vaccine, we have completed 89,000 total doses. And again, remember, it's a two dose regimen. But again, 89,000 total, and patients, 52,546 of those. So we are moving along. The biggest challenge we have around vaccination is the lack of supply. And so, and that is going to continue. And I'm sure Rod's probably going to add on that. But that is, and that's not unique to Durham. That's not unique to North Carolina. It's not even unique to the United States. I read an article overnight about, or saw an article, haven't read it fully yet, but around the shortages in Canada. So that, again, it is wonderful that we have this vaccine. But we've only had it for 2 months. And I mean, if we think about it, we've only had emergency use authorization for just 2 months. And so ramping up that production of vaccine to be able to meet the incredible demand is going to take some time. So we continue to ask for patience. We have several sites set up throughout the Durham and Wake County. We're now vaccinating in a handful of our primary care clinics. And then we've started piloting a couple of what we call pop-up vaccination sites, and hope to be able to do a couple of those a week if the supply allows. But we did 2 this week, and I want to particularly thank Eleazar and El Centro for help with, we had a great event on Tuesday evening at the Latino Credit Union, and vaccinated 150 people that evening, which was wonderful. El Centro was there, La Semilla, and just an incredible community partnership there. So that was great. And then I want to recognize Reverend Davis and thank him. We were at his church last night and vaccinated 70 people there as well. So, and both of those, I will tell you, came up. I reached out on Friday late afternoon, and we were able to have those. So could not have done that without just the tremendous support and partnership. Really appreciate it. We are looking, of course, at teachers coming online as well for vaccination, which is great. But again, just want to remind everyone that the supply is very limited. So with that, I will turn it over to Mr. Jenkins.
Thank you, Katie, and good morning, everyone. And I couldn't say it better than what Katie said. Vaccine supply is very low, and as a direct result, it certainly affects our ability to get the vaccine out to the community. Nevertheless, we are not deterred. In the absence of vaccine, there's also knowledge that's being spread about it, and a lot of our efforts to date has been around vaccine education, particularly with communities of color, to ensure that they're able to make the right choice when it comes to vaccine. I think I come to you with determination. These days have been very, very long. Katie can attest to that, but nevertheless, we are not deterred. We are determined to make sure that we see this through. So I'll go into some statistics. As Katie has indicated, we're not out of the woods. January was not good to Durham at all. I think we had over 4,000 cases. I am proud to report that we appear to be on the downswing as far as the number of cases in our 7-day average. We currently sit at 1,021 cases. 19,779 individuals have beat COVID, have come out of COVID care. The number of deaths have been increasing as to be expected with a sustained level of COVID cases over a long period of time. We're now at 197 total deaths. And the total that we are at since the pandemic began to date is 21,002 cases. Our 7-day moving average has decreased, and we're thankful for that. We're now at 88 cases. That's a decrease from 137 last week and 127 the previous week. So we were seeing severe swings in our cases, and that was the result of us coming out of holiday infections and holiday gatherings. So we certainly hope that that continues. So far for the month of February, we've had 783 total cases. Suffice to say, North Carolina as a whole, their cases are stabilizing, but still relatively high. Durham's lab confirmed cases are decreasing. So we certainly hope that we continue to stay vigilant with our public health measures. In terms of race and ethnicity, we do everything through a racial equity lens. And proud to say that for the most part in Durham, Hispanic Latinx population right at 17.37%. So they're kind of stabilizing and staying under 20%. Black or African American are proportionally represented at 35% of all of our cases at present. And white continue to be underrepresented right now at 33.33% of all of our cases. We're still seeing infection in university settings. As you would imagine, colleges are back. It's been reported in the news that there have been a number of schools that have had some clusters and some cases. And we're continuing to work with our colleges, but overall, by and large, they're doing extremely well. We're still seeing cases in the construction industry with our Hispanic population, representing 85.71%. I'm sorry, 66%, but 85% are Hispanic males. And then, of course, our professional and scientific services, we're seeing some cases there. We still are thankful for Duke providing us their model as it relates to our percent of positive labs that are done electronically. That is going down, which is certainly an indicator that our infections are going down in our community. Last week, it was at 6.3% as presented by the state of North Carolina. Duke's model had us, Durham growing at 3.0%, and North Carolina's infections growing at 3.8%. So we're seeing it really go down, but there's always that but. We are really being cognizant of the variants that are out there. And if we're not careful not to really see the vaccine as a free pass to go back to normal, we need to see the vaccine as another public health measure to keep ourselves safe, but we still need to do the 3 W's, and we certainly need to make sure that we avoid large gatherings. New guidelines have come out from the CDC in terms of masking. I know Madam Vice Chair is extremely happy about that. They are recommending, double mask or a mask that has strong filtering in it in order to keep everyone safe. So again, I encourage you to read that information in order to keep yourself safe. Continuing on about positive labs, the 6.3 and 3% represent a decrease. Last week, it was as high as 8%. So again, we are on the downswing when it comes to our indicators, and we're certainly happy about that. Proud to report as far as testing, there's still a lot of COVID-19 testing. A lot has been said about vaccinations, but not much has been said about testing. We're still testing, and we still have plenty of places to test, but in partnership with Walgreens and CVS and a number of different places are definitely going to pay dividends. Proud to report that Walgreens is not only doing testing, but as reported in the news, they're also doing COVID-19 vaccinations. And that's by appointment only. And they're starting off with 100 vaccines administered per week in 11 locations in Durham County. So we're certainly happy about those 1,100 vaccinations that could come to Durham residents. See, Walgreens will contact their clients, and they will also make their appointments. I'm very interested in seeing their setup. I think I might pay them a visit just to see what it looks like. As Katie knows, it's a very intricate process, requires registration, requires the vaccine administration, but it also requires observation for 15 to 30 minutes. So very interested in seeing it, but very thankful for this partnership. So again, we continue to monitor COVID-19's impact on daycare and school-age children. As mentioned, of course, we're heading into phase 3 on February 24th, where daycares and school-age children in schools, not school-age children, I apologize, schools, teachers and ancillary staff will be vaccinated. And we continue to look at COVID-19's impact on them. So far for the month of February, 13.15% of individuals 18 years of age and younger have contracted COVID-19, which totals 103 individuals. So we're really, really paying close attention to that. Let's talk about vaccines. A little more about vaccines. As Katie mentioned, we're thankful for the partnership with Duke. We still have our Southern High School site that remains active and vaccinating lots and lots of people. We do recognize that if school does go open back up, we'll probably need to make some arrangements, but nevertheless, we will present that when the time is right. And again, Department of Health and Human Services here in Durham County has been vaccinating since mid-December, I should say. That continues to be a very good process. I have taken residents in the vaccination clinic, and for the most part, there are some long days, but it's comforting to see the people that come in for vaccinations. As mentioned, vaccine supplies right now, globally, nationally, locally, are anemic. It's not as much, but we are thankful for the supply that we get. Durham County Department of Public Health has been guaranteed for the past 3 weeks. Well, our third week will start next week. We've been guaranteed 600 doses. We have been fortunate to receive what they call equity doses in the amount of 700, and that's to take care of our communities of color and our seniors who are 65 years of age and older. And we have been doing just that. I think if you go to the state website, you will see that Durham is outpacing the state when it comes to certain demographics. And we're certainly proud of that because Durham prides itself on our diversity, and that also extends itself to how we are administering the vaccine. I'll be the first to admit, as public health director, I know that there's a lot more work that needs to be done with the Latinx population in terms of their vaccine utilization. We are proud to report that on last Saturday, we were able to work with Latin-19 and Cure Americas to vaccinate the community health workers. And I believe that we were able to vaccinate about 50 of our Latinx partners, community health workers. And that was a successful event, if you will. So we plan to do a lot more with that. Since receiving our vaccine, we have been charged with exhausting all vaccine the week after we get it. That is mandatory. That's a part of Secretary Cohen's directive. And we have been successful in doing that, be it through our partnerships to extend our bandwidth with local pharmacies who are considered to be eligible providers, who are able to go to independent living facilities and congregate settings and vaccinate on our behalf. We're thankful for those partnerships, or just partnering with our joint venture with Duke to make sure that we're able to schedule and get individuals vaccinated. We have exhausted, as of Monday, 87% of all dosages of Moderna that we have received. We have exhausted 60% of all of our Pfizer dosages that we've received. And again, we're blessed to be able to receive both types of vaccines here in Durham at the Durham Department of Public Health. Again, we are certainly thankful for all the outreach from the different community organizations that really think it not robbery to want to partner. But as Katie has mentioned, we're only able to do but so much in a very controlled manner due to the amount of vaccine that we receive. We are able to do events, but again, that's a request, a formal request that has to be submitted to the state in order to receive additional vaccines. And the one caveat is that you have to be prepared to have an event where you're going to vaccinate in excess of 500 or more individuals. So it has to be a huge event. So we're able to, again, do something with the equity doses that we receive. But again, we're being very patient because we do know that the state is really up against the wall in terms of the amount of vaccine that they're giving to the entire North Carolina healthcare workforce. The last thing I'll report is we are preparing in concert with Duke to vaccinate our teachers and staff. The one thing I will say to the listening audience is that this is a daunting task, because we're not just talking about the 5,200 plus people who are members of Durham Public Schools, but we're talking about private schools, we're talking about charter schools, and most importantly, we're talking about the daycare centers, independent and licensed facilities that encompass Durham. At present, we're talking probably in excess of 7,000 to 8,000 people that really comprise this group. So we are going to do the very best that we can. We are going to remain optimistic. I think I read an article last night. I think it was last night. My days are blending together, but Dr. Fauci keeps saying there's going to be open season for vaccinations come April. You know, in so many respects, ladies and gentlemen, in Fauci we trust. So we're going to hope that he is accurate in his assessment. I know he has inside information on a lot that we don't know, but we're certainly hopeful that come April, we'll have a lot more vaccine on the market. But we're continuing to work with the state. We're continuing to fight for Durham in terms of, additional vaccines, additional places to get vaccine. And this time, I'm more than happy to answer any questions. I apologize. I will kick it over to Dr. Akinboyo for some additional commentary.
Thank you, Rod. You covered most of it. There have been a lot of questions about variants. I think where the major concern has been our next tool is vaccination. And so if we have viruses that are mutating and potentially evading our next tool, so the next defense, it raises a lot of concern. We also know that the viruses need us to replicate. So if we're not spreading viruses, we will not be seeing variants. So we just go back to the 3 Ws, wearing your mask, washing your hands, and distancing until we get to a better place and time where we're seeing less cases will help with not seeing variants. That would be my only addition. Thank you, Rod.
Happy to address any questions the squares may have.
Vice Chair Jacobs.
Thank you. Great report, Rod. And I don't know I hope there's not a little cot in the corner for you in the Health and Human Services building. When you say you've taken up residence in there, I think it has been literally that. So thank you to you and your staff. I just wanted to follow up. I think it seems like one of the challenges is going to be around encouraging, keeping up the mask wearing, like for the long haul, and our messaging around that. you know, just for so many reasons that we just all, even after we get vaccinated, you know, to keep wearing masks because, you know, frankly, it's the vaccine isn't 100%, right? You can still get it and you can still spread it to other people unknowingly. It feels like that's going to be a really big challenge for all of us. I was curious about the something I read in the SIT report that we get, which was really interesting from the other day, that a lot of people are canceling their appointments, and then the wait list that we have now, the last minute wait list, again, when you call people, they've already gotten the vaccine, or the people are canceling because they've gotten the vaccine. And also that a lot of folks who are getting it in Durham, almost 50% are not Durham residents. So it's just an interesting dynamic that we have happening. Is that a good sign that a lot of people are canceling and that people on the wait list have already gotten it? What do you think that's telling us?
I will say thank you so much for your question, Madam Vice Chair. I will say, being the optimistic kind of guy, I would take it as a good thing. It is a vaccine without borders. And as I said to the Board of Health last night, people are taking the Motown approach and they're shopping around. So with that being said, it's not a bad thing. People are ready to get the vaccine, and we have used some innovative technology that we're thankful to partners with emergency management to have used. We do have the Everbridge, which represents our one call, and we've used that to whittle down our wait list. We started the week off with about 11,000 people on our wait list, and we used the Everbridge technology to email and to text the members on our wait list. And it's been successful, but not without a lot of hard work. Ladies and gentlemen, we've been able to take that list from 11,000 down to 3,000. And in the course of doing that, we found that most people have either gotten an appointment or gotten the vaccine and pretty much said that, hey, you know, you can take me off the list. So that just simply means that people are determined to get this vaccine or have gotten it. And again, we're grateful for our staff, you know, particularly our scheduling staff, because there's a lot of long hours to make sure that people are able to really get the vaccine, get the appointments and everything. But I do say that it's a good thing because, you know, it allows us to really, you know, concentrate on those individuals who really, really want the appointment. Again, you know, we still have our vaccine line up and running. We're just not taking any new appointments, and pretty soon I'm pretty sure that that's going to change. But it's definitely a strategy that worked in our favor, because now as we pivot toward teachers, it will allow us to have more bandwidth to take care of that.
Thank you. And I also have a question for Philip, because I was listened in on a national call with the Biden administration and about their vaccine rollout. And it seemed like besides going directly to the pharmacies like Walgreens, that they were also going to be focusing on the our community health system and getting vaccines directly through them. And so just wondering what you're hearing, Philip, in terms of you getting some direct allocations.
So far, only 25 community health centers across the country have received additional doses directly from the feds. The goal is to increase that to 250, and then once vaccine supply is no longer a challenge, to increase it even further. But what the feds are saying essentially is that since community health centers, federally qualified health centers, are the providers that take care of vulnerable populations, they could help to get rid of some of the disparities by making more vaccines available directly to health centers. So that's good news. So far, I don't think any of the health centers, there are 42 community health centers in North Carolina, and up to yesterday, the state association had not heard of any of them that are in the initial 25 health centers to get vaccines directly. At Lincoln, Katie, can I go ahead and just do a quick update on it?
Yeah, that would be great.
Okay, thank you very much. At Lincoln, 975 vaccines have been administered to date, including staff, 155 members of our staff, and 820 patients. Incidentally, 70% of our staff have been vaccinated. 65% of our vaccinations have gone to African Americans, approximately 5% to Hispanics. The Hispanic proportion will climb significantly as we move to group 3, essential workers. We've worked our way through Lincoln's list of established patients who are age 65 or older by calling everyone and asking whether or not they needed to receive the vaccine. Approximately 67% of those who have been able to reach wanted the vaccine and have been extremely appreciative and complimentary of our efforts. Currently, we are receiving from the state an allocation of 300 Moderna first doses weekly. 100 doses is our basic allocation, plus the equity bump of an additional 200 doses. Second doses are automatically followed at the appropriate interval. And we're managing to administer all of those doses each week. We've been vaccinating 200 plus persons on Saturday, full day Saturday, and approximately 100 persons during the weekdays. Basically every weekday, Monday through Friday, we do about 20 appointments each day to get that 100. And then on Saturdays, we do it all day to get the additional 200. Also this week, we broadened our access beyond Lincoln's own patients by reaching out to those 65 and older who are members of the faith communities. So we have a staff member who have been calling churches directly and asking for members who are 65 or older who have not yet received the vaccine. We've also reached out to El Centro, and we've focused on the zip codes that we draw the largest number of patients from. That's 03, 04, 07, and 05. This approach continues to allow us to serve predominantly historically marginalized persons and to promote needed equity in vaccine administration. Our biggest challenge continues to be around workforce, and we're requiring heavily on volunteers, 35 to 40, say, to do that weekend session that we do every Saturday night. I'll stop there, Kate, see if anyone has any questions.
Thank you. Any questions?
I've got a question. Do we actually know how many people in Durham have been vaccinated, or are these multiple numbers aggregated by anyone officially?
Rod, I think health department you have the aggregate numbers.
I do. I could definitely get back with you all, but again, that information has to be pulled from the COVID vaccine management system in the form of reports. And at present, George and others, it's more or less like a data dump. To get the actual numbers, if we go to the state site, it's going to give you a snapshot for a certain period of time. But in order to get the actual numbers real time, you have to pull it from the actual vaccine management system.
I just wondered, listening to everybody, I realized there were different numbers coming from different people and different organizations. And I'm not sure it's a good use of your time, Ron, to figure that out. But, you know, as metrics go, and as supply improves, it does seem like you'd want to know what percent of the population in our community specifically has been vaccinated.
We do have that information, George, on the state's website. We've encountered a little bit of technical difficulty. The plan was to have our forward-facing vaccination dashboard, if you will, attached to our data hub by yesterday. But again, we ran into a little bit of technical glitches, but nevertheless, we do, and Ryan just put it in the chat, but nevertheless, we are committed to making sure that we put that information in a forward-facing manner on our dashboard for our residents. So we hope to have that stood up at least by the middle of next week.
Yeah, and what I can tell you is for patients vaccinated through Duke, which based on the allocation is the bulk, the largest group, if you will, at this point, just based on the allocation that we've been able to receive over time. It's 13,855 of those have been from Durham. And we've completed 13,855 first doses, 3,734 second doses. So again, that is only patients. What I don't have is the employee numbers broken down by counties. So a considerable number of our team members who've been vaccinated are from Durham as well. So that would add to that. But good point in terms of that being a metric that we want to monitor and one of our sort of KPIs, if you will, moving forward.
This site that I think Ryan just dropped in the chat, when you hover over that map, it looks like it says Durham County 55,000. Is that right, Ryan? Or is that anyway?
Well, that's what it says. And I would just look to Rod and Katie, if this chart, if you go to this dashboard and hover on Durham, it says county of residents first dose administered and 39,000 total first doses administered. And what I don't know, and I guess I'd look for clarification, is are these administered within Durham County, or this chart is actual about residency status of those who have received the first doses?
To my knowledge, Ryan and others, that is supposed to represent in Durham County. But as mentioned earlier, it's a snapshot. It's not real time. It could very well be on a few days ago. Most of the time it's Monday. So again, to really get a good grasp on what's happening, you have to actually pull it from CVMS, and that can be a little difficult at times. But nevertheless, we will get the information.
Yeah, I think we're all really focused on the numbers and also the demographics, right? Because we're very focused on making sure this is equitable distribution and really, really focused on how do we get the vaccine to those who have been most impacted by COVID.
I think Mayor Shu had a question.
Yes.
Thank you. Great questions so far and great reports. Thank you. And I really was glad to hear, Phil, about how much you all have been able to do. I didn't realize you all had been able to provide that many doses. And I agree that that's so important for the equitable distribution of our vaccines. I wanted to just compliment a couple of different groups on the outreach. One of our seniors who lives at J.J. Henderson, Durham Housing Authority community, reported that she and others there had received calls from social services asking about their vaccine their desire to get the vaccine and to get them signed up. And Rod, I'm sure you all had a lot to do with that, and I want to appreciate that. And also, I'm a member of the Latino Community Credit Union, and prior to the event there, I guess they looked and saw how old I was, and they called me and asked me if I would like to come to an event for the vaccine. I had the vaccine already, but I was really appreciative of that outreach. And I just, whenever I hear these outreach stories and what Phil described about calling their patients, and realize the effort that we're making on the equity side is so individualized and personal. And I just want to express a lot of gratitude for that. Also, I want to appreciate, Rod, that you all have vaccinated more than 200 of our police officers now, and a like number of our firefighters, and that continues. And just, again, it's so great when these folks, it's such a relief when these folks are able to be vaccinated, and it's just, I really appreciate that. I do think that it would be good. I think we're all kind of struggling to figure out how many Durham residents are vaccinated, or, some ballpark of that. So it'd be great to try to understand that a little bit more. And nobody wants an exact number, but, just some sort of ballpark number of what we think it might be would be fantastic. And I just wanted to say about, I know that Go Durham is offering free transportation to vaccine sites, but wanted to say if there are any transportation needs that you think the city could be helping with more, if you all could, feel free to be in touch about that. I know our staff really wants to help in any way that we can. So, and then finally, just on the event front, if we do want to do an event, I just, again, will offer, to help publicize that in any way. I'm sure the city would do everything that we can. I know the county would too. If you all do decide to do an event where we are going for more than 500 people at once, I would love to be part of any of that work that you all need. And I do see that Ryan has posted in the free rides to vaccination sites for people that need to know about that. So thank you.
Great, thank you. All right, we're going to move us along on our agenda because we're a little bit behind, but appreciate all of the discussion and questions and really important information there. Let's get an update from our Economic and Recovery Subcommittee.
Thank you, everyone. Just kind of give you guys by way of a little bit of background. Our committee consists of myself, Dr. Tony Nelson, who I think we just saw in the chat has another obligation and had to jump. Susan from Discover Durham, Nicole Thompson from DDI, and we were fortunate enough to be joined over the last few weeks for our meetings by Eleazar Rosada from El Centro, and really enjoyed getting to know him and having his input through our weekly discussions throughout this past month or so. Just by kind of reminding you all, it's proven challenging to get, well, any kind of data, as we just heard from some of the data points we're looking for and still trying to sort of sift down. But economic development has proven challenging to get consistent and harder and updated than regular health data. But we found a pretty good tool that we're comfortable with, an Opportunity Insights Economic Tracker, and it's been useful for us to kind of track how we are performing as compared to our peer counties in the Triangle and also in the state. So what you'll hear from us as we kind of go through and give you an update on some of the KPIs that we are tracking is some additional recommendations for a deeper analysis on some of these figures in the coming months by some professionals outside of our smaller group. So we could go to the next slide. Thank you, Susan, for doing the driving for us here. What we're going to do is lay out some of the economic indicators and next steps and give you all an update on where we are on some of the current initiatives that we are all working on. I would be remiss if I didn't give a quick thank you to this team for working well into last night and early this morning, trying to kind of cobble these pieces together. So thanks for also for the support of Brian Fox to help pull this together in addition to our team as well. Anyway, so jumping on, what you're seeing here is that while on this particular chart on time spent outside the home, Durham, the Triangle are really leading the way on time spent outside the home. And compared to the state, Durham, Wake, and Orange, with the numbers that we have available from other counties, you can kind of see that gray off into the background, see how we kind of chart with everything else. The good news here is that Durham and the Triangle continue to lead the way. And I think it's a large part to a lot of the work of this community and this particular task force for public health recommendations such as safer at home. So I think that from a community health standpoint and a behavioral standpoint, this is a favorable chart. The next slide, please. So you can see, because even though we have are spending less time away from our home, our consumer spending does remain relatively stable. And in Durham, and it's not dramatically down. So it's about the same amount as it is in North Carolina and in Wake County. So we are performing consistently there. Next slide. But here's where it kind of gets troubling. The unfortunate part is that small business revenue is way down. So kind of track that with what we saw on the slide before. Consumer spending is stable, but small business revenue is way down. And for Durham, it's dramatic. It's dropped twice as much as it has for Wake or North Carolina overall. Should be noted that it's also down significantly more in January than it was for Orange, although through the past year, with the pandemic, we have been tracking pretty closely with Orange, and you can sort of see some of the similarities there with the reliance on colleges and the populations there and what that might look like for some of our smaller businesses in the more centrally located area. So the next slide, please, Susan. So consequently, because the small business revenues is way down, it stands to reason that more of Durham small businesses have in fact closed. We can point to a number of relief measures that I think have certainly helped us from being right at the bottom of business closures too. But we're low there as well, and seem to be trending down. I know Nicole is listening in right now. I don't believe that she has access to talk. I know she's on the road and was kind enough on her time away to at least call in and listen. But I know that she has shared with us, some of the work that she has done. That downtown is largely just staying afloat. There are closures. There are also new openings, but it is certainly struggling. It would be representative of the last two slides that we've seen regarding spending and small business revenue, and as well as closures. The next slide, please. So this depth is really available just at the state level. But I thought this consumer spending piece was important as it kind of breaks down to where those dollars are going. But I think this particular chart, we pulled this because I think it does provide a little bit of illumination. You can see here spending on things like services, hospitality, entertainment. It's all interrelated, and it drives Durham's economy. Subsequently, drives so many of our small businesses, and even more so than the rest of the Triangle. You look at so many of our big economic generators, our performing arts center, our baseball park, all those things, and the ancillary spending that comes from bringing people in. Carolina Theater. Other festivals and events that we'll talk on more later, and Bay and all those different things, bringing folks in, and consequently those spending. But it's been replaced by the spending on goods. So kind of walk with me that experience of spending and investing in some of these smaller businesses, which have really been not just the backbone, but really have identified the culture of what Durham is, has been replaced by the need to provide yourself just basic groceries and goods like that. So we are hopeful that this is a temporary condition, but it is absolutely something that we should be looking at and thinking about how we can aggressively continue to support our local small businesses. Next slide, please, Susan. So it stands to reason that it's the case that leisure and hospitality jobs have been hit the hardest. That hit the hardest by a wide margin. And this actually holds true to the condition we've been reporting out over the past few months, is that low-wage jobs are down far more and are at much higher risk, especially in our vulnerable communities and vulnerable population. And it's down far more than our middle and high-wage jobs. And this negative impact disproportionately affects Durham County as compared to other jurisdictions, other communities within the triangle, as well as the broader state. So next slide. So each one of these sort of builds upon itself here. So Durham's unemployment rate is also suffering more too. Going back to the county's numbers, Durham's employment rate has also understandably lagged, mainly because so many of those jobs are in the hospitality and services area. I think that hopefully retraining and upskilling initiatives, like we'd heard from Durham Tech at a recent meeting, and their back to work initiatives are taking hold, and it'll start having us trend in that right direction. But getting people reskilled, retrained in some cases, but also back to work is a key component in how we start driving additional people into some of our small businesses to help support is an important next step as we move into springtime. With that, I believe I'm turning it over to Susan now, and to take us through the next few slides, and then we'll open it up. Thank you.
Yes, and I'm going to apologize that I'm having some internet difficulties, and no, it's not bandwidth where me turning my camera off will help. It seems to be maybe an equipment issue. So I've warned Geoff, you may need to step in for me if I freeze up, but it usually only lasts for a couple of seconds. This is a look at what's happening from a hotel demand standpoint. We are at 40% occupancy for our hotels, and normally at this time of year, we would clearly be much higher. And at this point, I would say from a lodging standpoint, it's just flat. It's been flat for months. I think everybody's just in a wait and see mode. There's a certain amount of business that continues to come in, interstate travelers, transportation workers, a certain number of people here for medical procedures. And we're seeing our hotels are reporting that more and more it's staycations, people who just have to get out of their houses and will show up at a hotel at 4 o'clock on Friday afternoon kind of thing. And that's something that we're certainly going to encourage, but lodging is still down dramatically. And some of those numbers that we've shared, which are the best numbers we have available, are still, I'm a little skeptical, because I think it said restaurants and hotels are down 27%, and I know hotels are down 60%. And I think restaurant, so yeah, sorry, I just cut out for a second, didn't I? Let's keep going. We have had, the committee has had some discussion about what we think is driving the difference between Durham and neighboring communities. And here are 3 hypotheses we have, and wanted to open it up a little bit for discussion if others have some things that they're thinking about. One is the changing dynamics of commuters. We know that there are a lot of people who travel, workers who travel into Durham during normal times every workday, and they're now mostly staying at home. So that is cuts down on the number of people coming in. Second, of course, is that our entertainment venues and our events draw a lot of visitors, and those are not able to do that right now. And those feed a lot of our small businesses which are hospitality businesses. And the next is the spending by college students, parents, and visitors, visiting faculty members and vendors who are coming to our universities. That is a huge portion of travel, and that's not happening right now. And I think that while we are known as an area that is full of university towns. I think the impact of our universities is proportionately larger than some of the, well, we'll take Orange County out of it. But in terms of Wake County, Durham is larger than the impact NC State is going to have on Raleigh. So just wanted to open it up for a second on additional hypotheses about why Durham is performing differently. One of the things we've discussed is the idea that Durham is doing a better job of staying at home. But if you recall, when we go back into the early slides, consumer spending in Durham is about the same as these neighboring communities.
I actually think the drivers you've outlined there make a lot of sense. I don't know if there's anything else at work there, but these three combined are pretty significant and would have a significant impact.
They are. I think what we are attempting to do as a committee is reach out to get support from economists who can help get to a deeper level of data if it's possible on these things, because the kinds of solutions that would apply are going to vary depending on what the balance is of these items. Frankly, I think the changing dynamics of commuters might be the hardest thing for us to affect. If it is more about the entertainment venues and events, it gives more credence to some of the work that we're trying to do and the need to really push on that and figure out how to support our events coming back and how to attract visitors once our entertainment venues can reopen.
And Katie, I think you're exactly right in that is your assertion. When you look at the Durham spending remaining relatively consistent, it just shows you how reliant so many of our small businesses are around the visitor economy and our demand generators such as the ballpark and DPAC and Carolina Theater and our events and our universities, North Carolina Central, certainly Duke as well, Durham Tech, and the visitors that come in from there and spending those dollars. So that's really what I think you're seeing right now is that some of these inputs from other folks who would come here, not necessarily for long extended weekends, but just really crossing over county lines to take advantage of some of the various different amenities. And I think the right word is experiences that our businesses can provide them. We're not seeing that. And I think that's really where the large discrepancy comes in.
Yeah, the other thing that Ryan put in the chat is, increased online consumer spending at places like Amazon versus local retailers. So I don't know if I would imagine that's having an impact as well.
It would. We talked a little bit about that, whether for Durham County versus we talked about whether that'd be different for Durham County versus the other communities.
True. Maybe not.
Well, it could be, or that people are spending more money at Walmart and Target than they are at local retailers. That's hard to say. And that gets to why we'd like to look at additional resources to dive into this. All right.
And I could real fast. Think about what your household needs and the fact that we're all staying at home. And it is things like, paper towels or water filters and toilet paper and aspirin and coffee and all the stuff that you might be getting out at your workplace. Well, now you're living at your workplace in large parts. And so where do you buy those types of things? You're eating lunch 10 feet away from your refrigerator as opposed to 5 miles away and from your office and what that looks like. And so just think about how we all individually live as we continue to work remotely. I think that kind of gives you an idea of sort of what those spending patterns might look like. I'm sorry, Susan, I did not mean to. I should have saved that one until you glitched.
Quite all right.
Can I ask a question about that? So, Susan, you all have done a great job of standing up Durham Delivers to help our restaurants. I wonder if we can do more to try to get people to order online some, other kinds of retail, local retail. I don't know that, I might be wrong, but I don't think we have had a big push, with an associated marketplace, an online marketplace for local retailers. Any thoughts about that as a possible strategy?
Yeah, I know that we local retailers. Sorry, I glitched. Discover Durham works to promote local retailers, and I know that Nicole and DDI have been really involved in promoting our downtown retailers, and there have been various programs that have come out around that. But I'm curious, do you have some other thoughts about specifically what you think might have an impact?
Well, I've just listened to what Geoff said, and I thought he was right. And I thought that's, I know what my habits are. I have, well, I'll just use an example. I consume books. And so I buy from our local retailers by ordering online. I bet you a lot of people don't. I bet people are reading like crazy now. They're at home. And I bet you, most people are ordering from Amazon. And you could extend this to so many other categories, I think. Is there, are we doing enough? So I'm not sure. I just think that maybe we could stand up a more unified Durham local online retailer, purchasing site that we would, push harder. And I agree. There are certain, you all are supporting our local retailers. Certainly downtown Durham Inc. is, but is there something we could do that was more unified and powerful? That's really all I'm asking. And I think maybe there is. I think people in Durham would love to buy local online if they knew all their possibilities. The same way that our mask website has been so successful. Local online mask, vendors. Could we do that for, a whole, big bunch of retailers?
Well, we'll take a look at that and come back with some response on that. But I appreciate that thought idea. All right, move on to this is our last slide, just to give you a brief update on things going on. Maticia already referred to the Festivals and Events Work Group, which is kicking off shortly. And the idea is to have a group of decision makers in Durham who can help our events come back sooner and stronger, as quickly as the ordinances allow, and we feel comfortable with people coming out safely. Durham Delivers continues to expand and do really well, and is growing. We've generated about 80,000 in revenue so far. And February deliveries so far are up 15% over January. So each month, we've got 45 participating restaurants, 35 communities, and those numbers continue to increase. And I think Nicole has mentioned before, the intent is for the streetery to come back as the weather improves this spring. And so I know that DDI is supportive of that. We've got a few other ideas in the works, nothing ready for prime time quite yet, but we're looking at how we help the hospitality economy recover, in particular, knowing how deeply it's been affected, with as many initiatives as we can develop and execute. Geoff, anything that you would like to add?
I think we certainly covered the presentation there. We would love to hear from you all if there's anything we can ask. Appreciate the mayor's suggestion and recommendation there. We'll certainly at future conversations take that up. And I'm enjoying an echo of myself in my ear right now, so I'm hoping you all are not. But I'll stop talking and hopefully the two voices will stop in my head. I'm hoping.
Thank you, Geoff, and thank you, Susan. And Geoff, we did not hear an echo, so You don't have that to worry about.
This could be a
Lots of-
really new, interesting chapter in my life then, because maybe I'm not hearing one really either.
So lots of great information. So many thanks to you and the team that's working to pull together this information. And I think it's really important that you keep us abreast of these metrics, because I know me personally, these metrics, I usually don't see these metrics. And I think as a task force, it's great for us to be made aware of these metrics, and we can make some recommendations, suggestions around, so then what do we do? Here's what the numbers are telling us. So how do we take action and make some improvements as it relates to the metrics that we're seeing? All righty, are there any questions? Yes, Vice Chair Jacobs.
Thank you, Maticia. I'm hearing an echo now too. I don't know what's going on. Okay. I'm just going to ignore it as well, Geoff. I want to thank you all.
Ride the dragon.
That you're doing is so important, and it's very alarming though.
Vice Chair,
Yes.
Jake, I wonder, can everyone else let's just try if everyone else mutes if it addresses our problem. So if you could, if you're not muted, please mute, and let's see if that fixes it. Thank you. Sorry.
Okay. I think that helped. Thank you, Ryan. It is very alarming though to see the numbers and how we're disproportionately being impacted in Durham, especially those unemployment numbers, how much higher our unemployment rate is compared to the state and our neighboring counties. And so I'm wondering if you all are going to also come back as you kind of dig deeper into the data with recommendations for us and for city and county government about our recovery and what kind of things that we may need to be planning for, especially around retraining, but also what are the long-term implications to our small businesses that have frankly just completely closed. And thinking about the impact on, for instance, commercial properties, if people can't pay their rents, just kind of what are all the kind of long-term economic implications and possible, solutions and things that we, again, as local governments need to be looking at. And I'm also wondering about, I know I saw that the State Restaurant Association is appealing to the state for more direct assistance to the hospitality industry. There is assistance in the federal relief bill. So, just wanted to hear your thoughts on just the short term, what is needed or what could just help people just survive until we get through everyone being, vaccinated and really reopening the economy.
I know I think there are several things that are part of the solution. To me, it is that we need to be encouraging people to get out and go visit local businesses, to the point Mayor Schul was making earlier and I'm guilty of this too, to stop ordering from Amazon and go to your local businesses or order from them online where you can. So more to promote that and encourage people to participate in that way. I think we have to, we have all been consumed with focus on the healthcare issues and testing and now vaccines, and that's all very important, but we're also going to need to really put a focus on, we all have to come together if we want our businesses to survive. So I would say that if we can build that into our communications over the next 6 months in more forceful ways, I think that would be a real positive. And Ryan's reminding me that that is a part of the pledge that we're asking people to take, that they are going to support local businesses. So we do need to ramp that message up.
Also, Commissioner Jacobs, from our standpoint, and we talked a little bit about where our other spending dollars come in. and how reliant we are on our neighboring communities to help support our small businesses, and how fortunate we also are to have so many experiences that pull folks in. But for I think a longer term strategy, and it's less relief than it is an opportunity, we really enjoy a tremendous relationship with both our economic development partners in the city and certainly as well in the county. And our economic development teams do continue to work together to bring in job opportunities for all of Durham residents. And harnessing that growth for the benefit of all, I think that's where the opportunity is. And I think that it goes beyond just relief, and it just goes towards sort of the longer term goal of growing this community, so we can help prop up some of these smaller businesses that are so reliant on the jobs and the employment base here.
All right, very good. So I'm going to move us along on our agenda to the next item. And so the next item on our agenda, we have a couple of updates that will be provided by various folks. So I will start with Dr. Davis to kick us off with an update on the Places of Worship Roundtable.
Thank you. The Places of Worship Roundtable, we've been still meeting twice a month. It's been going well. We have seen an uptick in our attendance. We still have had some that were with us in the beginning that started and kind of fizzled off, but we've seen an uptick. Currently, we are working on crafting a letter that we are hoping to be able to view, that a couple of our committee members put together. And this letter is about encouraging vaccinations. And so we're looking to do this letter like we did the previous ones. So we'll be getting approval for it from those who are our regular attendees. And then we'll be asking them to help send it out to other colleagues to get them to sign on, so that we can then send out a letter to the entire faith community, trying to encourage people to participate in vaccinations, in getting vaccinated. We also were privileged to have Dr. Wolf and Dr. Akinboyo do a forum for us, and they did a phenomenal job. And so we were able to, Ryan recorded that, and so we've been sharing that with other faith leaders, hoping that that would also be an encouragement around getting people vaccinated. So things are going well. As I stated, we've seen an uptick. We have a core group that is consistently with us, and then we have others that kind of come in, come out, but everybody is still seeing it as a positive time together. And we also are starting to gather names of congregations that would possibly be willing to participate in other pop-up clinics, as Katie mentioned earlier. So things are going well. Thank you.
Thank you, Dr. Davis. And that's certainly great to hear, the fact that while some members may have kind of fizzled out, but you're seeing an uptick in the number of folks that are joining, that continues to join the Places of Worship Roundtable. And so very appreciative of the work that continues to be done by that roundtable. All righty, so next up we have Susan, and I think you guys heard Susan mention a little bit about the pledge, but Susan's going to give us an update on the Back on the Bull campaign, as well as the pledge, because I think she sent an email out to all of us reminding us that we should be taking the pledge.
Yes, I didn't hear the last of what you said, Maticia, but appreciate those of you who have gone online to do it. I'd ask for a show of hands, but we'll give you to the end of the day to all go on and hopefully complete the pledge. Very good, thank you. This is a major component of how we want to encourage people to get the vaccine, is getting influencers in the community to commit to the pledge. And I think you all understand, we'd love to be able for influencers to say, I got the vaccine. Since we can't do that because we're not all eligible yet, We want people to go online and record this video taking the pledge to get the vaccine. And we intend to promote those messages as ways to influence our community. So really, the fact that we are waiting for approval by the city on half of what we've put forward as funding for this campaign, $75,000. And then we're very hopeful that the county commissioners will approve the other 75. 150,000 in communications over a 6-month period is not a lot of money. But we will stretch it absolutely as far as we can. And for right now, it's going to be using organic social media channels. So we're going to ask you all to participate in that as much as possible early next week as the pages on the website go live, where people can take the pledge. We're going to promote that across your channels, across channels that you might be able to direct associated with your organizations. We'll give you social media graphics and some content that you can use. So just ask that everyone participate in that. I want to recognize a couple of people who've had a huge piece in this. Margaret Pentrack is on the call this morning and has been leading this communications committee. And that is a group right now that's working on how to get this message out. Are part of the Center for Advanced Hindsight. They have created the pledge using their magic with behavioral insights and are creating this whole interactive capability where you all can go on and quickly and easily record your videos and have those posted to the site. So the site where you will be able to see, right now you can all go on and record your pledges. The site where people can go on and see it is supposed to be, we're soft launching it today, and sometime in hopefully the first half of next week, it'll be ready for prime time, and that's when we'll start pushing it out, and you'll get more information about that. So I really appreciate that. Now, Mike, did you have some things that you wanted to share about this?
Yes, let me share my screen.
I think I heard you had show and tell, which will be great.
I do, yes. We'll let you all see what we've got. All right, so this is still a work in progress, but as Susan said, we'll be live by early next week. So this will live on the existing Back on the Bull site. And we will provide, so we've got this fancy new pledge badge, which will be one of the things that folks can share over social media. We've got detailed information about the 3 main components of the pledge, and which I think many of you have seen in the mayor's request for your video. And then we have the beginnings of a really fantastic bank of videos of local leaders, many of you here. And I thought I might play a couple of them for you.
Hello, my name is Donna Banks, and I'm the pastor of McMahon United Methodist Church. And I am here to accept the Back on the Bull challenge, which means that I will take the vaccine when it's available to me. I will continue to social distance and wear a mask and to support local businesses in our community, because I believe the vaccine has the ability to save lives, especially those disproportionately affected by COVID-19. I also believe the science and the ability to reduce the number of deaths associated with COVID-19 in order that we can get back to worshiping together, celebrating family occasions, and maybe even seeing a sporting event or concert. So I invite you to join me as we accept the challenge of Back on the Bull. I know we can do this. Bull City proud.
Hi, I'm Trey, the owner of the Chicken Hut in Durham. I'm taking the Back on the Bull pledge, and I'm asking you to join me because I want to get Durham back to what we all know. Dining in restaurants, spending time with family and friends, enjoying sports, and most importantly, sending all of our kids back to school safely. One thing I'm looking forward to doing once we're back on the Bull is opening my dining area for all of my customers to enjoy a great meal. Won't you join me?
Hi, I'm Yvonne Coleman, and I'm excited about getting my shot so I can contribute to getting back on the bull. Let's do this. I want to get back to seeing great plays and concerts at Carolina Theater, going over to Hayti and seeing a wonderful exhibit and hearing a concert, going to Walltown Children's Theater and going to BU and having a great cup of coffee, and most importantly, to be able to hug again. Let's get back on the bull, Durham. We can do this.
We'll do just one more.
I'm Vince Price, president of Duke University. And on behalf of all of us at Duke, I'm proud to take the Back on the Bull pledge to wear our masks, keep our distance, responsibly support our local business community, and get vaccinated when the time comes. This has been an incredibly difficult year for all of us in the Bull City, for our neighbors on the front lines of the pandemic who are treating patients in clinics and hospitals, for business owners struggling to keep their doors open, for so many who are balancing remote work and the pressures of caring for kids or elderly relatives, or struggling with the financial toll of a lost job. But we are strong and resilient. And most importantly, we are Bull City proud. And it's no coincidence, by the way, that bulls look a lot like devils. Duke is with you, Durham, and we're back on the bull. Come join us.
So we have 20 videos that have been submitted so far and are on the site. We've got more cycling in. And then we will also allow the general public to commit themselves to the pledge, share their name, share their reasons for taking the pledge, and then just as importantly, giving them opportunities to share that they've taken the pledge and they've made that commitment. So we'll make it easy for them to share via social media. And we've also created a Zoom background as other ways for folks to communicate to their community that they've taken this pledge and made this commitment.
And one thing I would add in here, we especially want some people who would be able and willing to do their pledge in Spanish or other languages that are part of our community. So please, if you are one of those or know influencers who would be able to do that, we'd love to have them on here.
Yeah, I was about to let y'all know that we are looking at some of our community health workers as well, because I saw the email that we probably do some in Spanish. So I wanted to see if that was something useful as well to kind of recruit some of the folks who are out in the community to do something as well, or one of the videos.
Absolutely.
Perfect.
Well, Mike, thank you all for the incredible work that you've done on this. It is really bad.
Yes, this is absolutely awesome. So thank you so much, Mike. Many thanks to you, Margaret. Many thanks to you, Susan, for your leadership as well. I'm just blown away at the videos that we saw. And I see the comment that Katie put in the chat. I think I need to redo also after seeing those videos.
Yeah. The pressure is on.
It is. So if you haven't made your video, no pressure. All right, awesome. So again, I'm just amazed at that great work and glad that we can provide support to take the pledge and share it with our Durham community, to encourage others to take the pledge as well, because we're all in this together.
I did go back in and change mine when I saw those. Even though I was the example, once I saw the ones that people did, I had to go in and make a better one because they really are fantastic.
Absolutely. So next on our agenda, we had, there was an update that
was included from our UNC Health ambassadors. We weren't going to spend any time talking through the program today, but just wanted to share with the task force the great work that's being done by the health ambassadors. There's information in the document that was shared related to progress that's been made, staffing and training, as well as just many partnerships that have been developed. So if you haven't had an opportunity to take a look at the information included, please do so. I know we have many other roundtables that are still meeting. Do we have any other updates from roundtables that folks would like to share? So not seeing anyone with any, then I'm just going to open it up. And I thoroughly enjoy the time when we have an agenda that allows us some time just to do roundtable just with the task force. So I'm going to open up the floor to see if there's any topics that anyone wants to bring forward to talk further about. Now, usually there's something for us to talk a little bit more about, but I'm not going to force it. No other topics we need to cover today?
You know, I'm never at a loss for words. I'm just hearing about, and I didn't read the full report or article in the paper this morning about the schools. I remain, like you all are, very concerned about our school-age children and what we can do to support them. So any thoughts or suggestions from this group or from others as how we can support our schools individually or collectively, I think would be great.
Well, I'll just say a word about that, Lois, and I'm not the expert, but we've got the legislation that is in front of the in the General Assembly. It looks like the Senate and the House will come together on a version of that legislation soon. It will require that our schools go back 15 days after the legislation is signed. I would anticipate, and it's probable that if it was vetoed, that it would not, that there would be an override. So it seems most likely to me, I'm often wrong about these things, that there would not be a veto, but the governor might hold it on his desk for 10 days to give it a little more time for the school system to get prepared. So I think it's quite possible that in 30 days from now that schools will be open in person with an option to, for everyone also will have an option to stay online. The legislation offers schools a choice between what they call minimal or I think moderate social distancing. Each system can choose what it wants, and I'm sure that ours would choose moderate. The legislation does not apply to charter and private schools, which seems problematic to me. And then, as Rod has already discussed, the February 24th, vaccinations will be open to teachers and other school personnel. And I think Rod identified, 7,000 or 8,000 people in our community who would need to get those vaccinations. And I know that Duke and public health are already working to try to figure out how to make that happen. It is, and I think that's so crucial for our teachers to feel a comfort level. I was last night at Food Line. There's on Hillsborough Road. There's a checkout person I've known there for many, many years who works at Food Line and also is a teacher's aide in Durham Public Schools. She works really hard. She's 62. She has not contracted the virus yet, although she's in public contact all the time at Food Line. And she was ready to go back to school once she had her vaccine and very, very concerned about getting it, which I greatly understand. So that, as I understand it, is the situation. I'm sure things can change in the legislature. I know the House and the Senate still have to reconcile their different legislation, different versions of the bill. But that's my understanding. Others may have more knowledge that they want to add.
So I was going to jump in. I'm no expert on legislature here, so I'll defer to others on the call. But I think the science has suggested that we can provide education in person safely, even with somewhat chaos around COVID-19 surrounding us in the community. But I really appreciate the question that was asked, which is what can we all do? And I think as a group, the more we do to get our rates down, the more helpful it will be for successful reopening whenever that does happen. It may be in a few weeks, it may be in a few months. All of the strategies that we know certainly work within the community, and there's no reason to suggest that it wouldn't work within a school setting. But the decisions around schools and around where education happens, virtually, in person, always pull in much more than just how kids transmit infections. Do they transmit to teachers, staff members, bus drivers, our cafeteria workers? It's much broader than that. It's about resources that we need to funnel into the school system to ensure that they can continue to have COVID-related mitigation strategies that are funded for, and they don't have to worry about that. It's also about creating that flexibility. I think we've learned that flexibility is important, and we need to pivot quickly if the plans are not working as intended. And some of that might be ensuring the policies that come through allow for flexibility and just a ramp. You can't go from 0 to 100. There's no way it will be successful with managing COVID. So I think it's encouraging that we've had a ton of data that suggests that education can occur in person, but some people have also thrived with virtual learning, and allowing that in some format to continue will also be good. And I will continue to encourage masking and washing hands so that our community rates are low enough that we can support our schools.
I would just add to follow up on Dr. Akinboyo about the resources. I believe in the bill that was just signed by the governor, I think it's about 40, I want to say close to $40 million going to Durham Public Schools to help with COVID-related expenses. But there's just thinking logistically about what it means to reopen in terms of bus transportation and having social distancing on the buses. I know from Durham County, the cleaning costs are very, very high. The kind of cleaning that's going to have to take place in the schools, thinking about PPEs, ventilation needs. So there's a lot that has to go into just making sure, even after everyone gets vaccinated or as we work up, because we know once even school personnel can start getting vaccinated, of course, it's going to be between the first and second dose, right? At least a month. So there'll be a need for a lot of resources as well for our schools to be able to safely operate. And so there may be a role, Lois, I don't know enough about what the schools need, but for us to, as a community, be able to help with some of those resources as well.
And there is a note in the, I'm sorry, I'm echoing. A note in the chat from someone saying they're also concerned with filling in the education gaps and accelerated learning, need to direct personnel support and individualized instructions, tutors and mentors, learning pod-like learning centers. There's so many logistical needs, and it's direct support to be getting our kids growing academically. So I think that's an important, thank you, school board member Javonia Lewis. So we've sort of, I think the one other thing I would add is, as challenging as it is, we are going to have to some extent, manage some expectations around the vaccine. It's wonderful. And I think we're all really excited that teachers are added to the next group up to be vaccinated, but we're still vaccinating groups 1 and 2 as well, and still do not have enough supply of the vaccine to be able to meet the demand in those two groups. So this is until that supply eases, which I think we're all hopeful will come in the next, time here. It's going to be challenging. So I think we just have to manage that. It's not that a week from now, everyone will be able to be vaccinated, because the supply just simply isn't there.
And I echo that, Katie, by saying that on a call that we had with all local health directors and the state health department, I think the expectation that we had was that we would kind of debrief on the governor and the secretary's comments, and we would have received some more information about an added allocation or some semblance of extra allocation to come. And unfortunately, that was not the case. As Katie mentioned, we are having to do this at present with the current allocations that we have. So, the expectations, should be met with, current present day expectations, if you will. I am hopeful that it will improve, but they have not given us any indication that it will. One of the things that we did as an association of local health directors is ask those vaccines that you've designated for events to include those doses that are for 500 people or more. Can you give that to us to take care of our schools? That's being researched at now. I think that's the way to go. But to meet the needs throughout the state, we need more vaccine. So I just wanted to express that as well.
The good news is that when we get the vaccine, we are ready to go operationally. We can make this happen and get people vaccinated quickly. So we're in a really good position for that. And that is not a criticism of the state at all. This is, again, it's a national, international challenge with just a brand new vaccine that needs to be manufactured.
So thanks for all of those comments. And Lois, thanks for raising that, and for us to consider what can we do as a task force to support a need that we currently have. I think this is a broad issue for us to address, but we also have the Education Roundtable, and Durham Public Schools sits on the Education Roundtable. So that would be one way that we can get some insight into things that we can do. And I would say, as you guys are out in the communities and hearing things that we can do as a task force, and to Lois's point, even individually, let's just make sure that we make each other aware of those things and figure out how we can contribute. So thanks again for raising that. All right, so we are at 9:57. We probably don't have time to talk about any other topics. Chair Howerton, I don't want to put you on the spot, but we haven't heard from you. So if there's anything that you want to share, I want to just give you an opportunity to do that before we close out the meeting.
Thank you so much. I appreciate it. It's what you call double tasking this morning. I've just been listening when I could, but I am hearing what you all had to say. So I don't really have anything this morning that hasn't already been shared. So I won't take up your time. I just appreciate all the work that each and every one of you that have done. And yeah, thank you.
Thank you so much.
You're
All
welcome.
right. Well, with 2 minutes to spare, I will say that our meeting is probably done. I don't think we have anything else to chat about. So thanks everyone for your time this morning. I wish Nicole was still on so I can joke with her about an early 8 o'clock meeting, but I don't see her on anymore. But do appreciate your commitment to getting up early on Friday mornings to not just sit through, but to participate in a 2-hour task force meeting. So great work that you've done in the past, and great work that I know that you'll continue to do. So thanks everyone. And
I think we had, was Eleazar, did you have something that you wanted to add?
Yeah, really quickly, and I hope you can hear me through them as people are starting to arrive, so I can be safe. We just have a couple of things, maybe announcements. So we're doing another vaccine event for Latinx folks on Tuesday. So I'll be sharing that information with y'all. We were able to secure 200 doses. while it's going to be out of our Raleigh office, we also had a lot of folks who weren't able to come on this week that have been transferred into that list. So we already have like 80 people in the Durham area who are going to be who are reaching out to get them vaccinated. So I'll send that over so that y'all can share it with your staff, as well as we have ongoing today out of our Durham office in partnership with Fed Up. We have food distribution. So if anyone knows anyone who needs any food, they're giving out produce. I think there's the chicken, the cheese, a bunch of stuff, right? So there's perishable, non-perishable, and produce. Either way, a bunch of good food. So if you know anyone who needs it, please send them over.
And so thank you, Elazar, for that. One final thing I do have to mention is any budget proposals. So if there's any budget proposals that you are aware of, as I mentioned, Ryan's going on paternity leave, and I'm sure if we send him an email, he just might respond, but I don't want us to send him any emails. So if you're aware of any budget proposals, please make sure you send them to Katie or myself so that we can pull together our budget subcommittee to vet those proposals and determine what the next steps are. So just wanted to remind you of that. All righty. Well, thanks everyone for a great meeting today, and we'll see you in another month. Take care.
Thanks, everyone.
Adios. Buenos días.